Hi, Reese. My name is KP Sompally. I'm a school committee member. Today, I have pleasure meeting you to chit chat about clinical social work as well as therapist work, what you normally does every day. I know you are a licensed therapist in the state of Massachusetts.
That's
You
right.
deal with anxiety, depression, bipolar disorder, and autism spectrum as well.
That's
So,
correct.
yeah, I would like to start with, could you please tell us about yourself?
Yeah, absolutely. Well, thank you for that introduction and thank you for inviting me here, KP. As you mentioned, I'm a clinical social worker. That means I have my master's in social work. I graduated in 2009 from NYU. And clinical social workers, as contrasted with what are typically called macro social workers, are focused on medical settings generally. That we're providing behavioral and mental health therapy, and still do providing some of the other typical functions of social workers in connecting our clients with other resources. But we are generally therapists.
Well, it's a great college, and by you, Reese. I'm glad to know that you've been to New York as well.
Yes, I actually I grew up outside New York and I studied my undergrad up here in Massachusetts. I went back, but after graduating with my master's, I returned here to live with the person who's now my spouse, and we moved to Franklin in 2019. Um, Career-wise, I've worked in a variety of settings. I've worked in clinics, hospitals. I've provided outreach therapy in which I travel to my clients' homes or other settings in which I then meet them where they are and provide therapy. And I've been working in private practice since 2014. And now I exclusively work in my own practice, but still connect with other services as needed because that's part of the work.
Oh, great to know that you work on yourself. It's a great thing to know. Moving to the is a mental health. In your perspective, what is a good mental health you can think of?
I I think I think what constitutes good mental health, it could vary from individual to individual, but I think there are going to be commonalities among all of them. And broadly, I would consider that to be the ability to maintain functioning, essentially, being able to do what you need to do from day to day to keep yourself moving forward and manage the pressures of life, however they present themselves. And the reason that I would say it varies is because people's individual goals may vary. Everyone wants something different for themselves, but being able to continue moving forward despite those pressures, I think it really makes kind of summarizes what good mental health would be. Generally, when I'm setting goals with clients, that's what we're looking at is what what do you want to be happening that's not happening, and what are those barriers to being able to achieve those goals? How can we remove or overcome those barriers? Um, so I think that generally summarizes good mental health, and there are of course certain concerns as well with maintaining perspective that's reality based, and that's something that is important to be mindful of as well. Is whether it is perceiving people who may perceive things that aren't actually real, or more commonly perceiving things that are real, but interpreting them in ways that become more harmful to you as an individual than they may actually be.
Yes, that's correct. Um, Normally, they say like there in every subject, there will be several rules of golden rules of the particular subject. In mental health, what do you think of golden rules of mental health?
This is an interesting question, and I will say I appreciate you sharing this question with me before we met because it gave me some time to think about it. When I work with people, it is so individual specific that the approach and what we talk about is going to vary. Sometimes greatly, sometimes not as broadly. So in that sense, there's nothing that immediately popped out to me as a golden rule. As I thought more about it, two things came to mind. One of these is a concept from a therapy modality called acceptance and commitment therapy, ACT, in which the idea is focusing on an individual's values and the idea that decisions we make bring us further away from or closer to our personal values. And the more often we're able to make choices and behave in ways that align with our personal values, the more centered we will feel and the more mentally well we will feel. And I think that's a very compelling idea. It's something I apply to my own actions, and it's something I talk about with my clients as well in helping them navigate difficult decisions. So I think that could be one of the golden rules of mental health is making sure that your behavior is aligned with your values. Another thing that came to mind, and this is maybe more of a concept or something to keep in mind, but is trying to be aware of how our personal interpretation of events and the narrative that comes from that impacts our reality. And there is a concept called thought distortions, or more simply, unhelpful thinking styles that I think are helpful for everybody to be aware of. And these are just different ways in which we interpret events in ways that can be unhelpful for us. An example I can give of that kind of way in which narrative shapes our reality, that I'll use from myself personally, is the feeling that at the end of a long day of work or whatever else has been going on, many people, myself included, are faced with, kind of household maintenance things, chores, getting the dishes done, folding the laundry, making dinner. And it's very easy to kind of feel very tired and thinking, oh, I have to fold the laundry now. I have to make dinner now. And switching that narrative to I get to rather than I have to can change a lot. And I think it's easy to say like I get to fold the laundry. I mean, who cares if they get to fold the laundry? But thinking of it in terms of I get to changes the narrative from this is an obligation that I don't want to do to this is an opportunity to take care of myself, to take care of my family, to show the people around me that I care for them through a very specific, discrete action that I'm doing to take care of ourselves. And that lightens the burden somewhat. That kind of brings in a more holistic picture of what it means to as something as simple to do as chores. And so that's a minor example of that kind of like reinterpreting the narrative that I'm talking about. And when applied to like deeper and deeper levels, especially when we're getting into things like depression and anxiety, that can be very powerful. So I encourage people to educate themselves about thought distortions and think about how they might that awareness can inform your ability to reinterpret events or other things that you experience.
Very good example, Chris. Um, in daily life, we meet so many people, we meet so many our well-wishers, so many our friends. But some of our friends are, normally they're in a distress, but we don't even notice that. Is there anything we can alert us that a friend, our classmate, in a distress? You can think of any clues?
Absolutely. So I think that one of the big things is behavioral changes. And when you know somebody particularly well, it can be easier to pick up on this than at other times. But very typical warning signs that somebody is depressed or otherwise going through a very difficult period is that they're withdrawing from things that they typically enjoy. They don't have the same level of interest in things that they might be very passionate about. And a major warning sign would be that they start giving away things that they used to care about. So somebody who plays guitar and is kind of not practicing as often, that's a beginning warning sign. If they say they're completely disinterested in it, could just be a change in phase of life, but checking in, seeing is like, what is going on here? How come you're withdrawing so much? If they're trying to give away their guitar, that might be a sign that they need more immediate help, because that can be reflective of a loss of hope for the future. So I think those are major warning signs. And overall, I encourage people to check in and ask directly to people that they're close to about how, how they've been doing, how they've been feeling, making sure people know that they're valued, and having those conversations of, you haven't hung out with us the past 3 weekends. We used to see you all the time. We miss you. What's going on? And can I help you at all? And that can be really powerful. And it can also sometimes just, you learn something that's going on behind the scenes that is maybe not like a high level of concern, but is something that you could offer some support with, or just a reminder that you value that person in your life.
Thank you. And one of the other questions, I'm focusing like, most of us, most of us under stress for the different reasons. Like some of them are, they stress for well, level 1 to 4 level. Like, some of the distress under level 3, level 2, level 4, like that. But what is the best way to ease the pressure, like out of difficult situations? For some people, for instance, for some people, the small thing is they seem like very under high pressure. For some people, they feel little pressure for under high circumstances. How would they come up out of that?
So how would people come up out of high pressure circumstances?
That's correct.
So I think answering this in two parts is maybe helpful. And so first I want to speak to kind of a mindset of regular self-care that I think is more of a preventative measure and a maintenance kind of step that you can take in terms of trying to maintain that balance throughout. And I think in realms of self-care where there's the need for productivity, the need for recreation, the need for connection, and the need for spirituality. And sorry, and one more, the need for physical health as well. So thinking of those holistically and trying to keep those in balance. So productivity could be satisfaction from work, but it could also be things like getting chores done, or working on personal hobbies, or something along those lines. Recreation can be lots of things. It can be anything from like reading, or more passive things like just watching television, taking some time to unwind, or it could be hooked in with productivity through a hobby, could be hooked in with exercise by playing sports. But taking that time for exercise and physical health is extremely important as well. We there are so many mental health benefits that come through exercise, and so often, I think for obvious reasons, we're focused on the physical health benefits of doing things like running. Um, but even just taking a walk, getting some time outside in green space and fresh air is very helpful. And to touch upon spirituality, for some people, that's going to be religion, but I don't think it has to be. It can just be getting in touch with the wonder of being here and what it means to be human and what it means to you to be human um and just taking time to try to be in touch with that. When things get heavier, I think, and especially when it starts to become difficult to keep those different life aspects in balance, and I should also emphasize the balance that's right for you as an individual, that may be when it's time to think about reaching out for some professional support, getting in touch with a clinic or another mental health practitioner, and scheduling a session to talk about what you're going through and getting that one-on-one attention to help set goals for yourself and design a path that will help you meet those goals.
Thank you. Um, Suppose, if any friend or classmate is showing some signs of distress, is there any resources that we can find the help, like online help or any appointments we can get off, like how soon he can get any help off?
Yes, so I think in the school setting, probably the best place to start would be going to the guidance counselor or school social worker. And and if there are barriers to doing that, maybe you don't know who the school social worker is, maybe you don't have a great relationship with your guidance counselor, unfortunately, then finding a trusted teacher or other adult in the school community and letting them know what your concerns are and that you're looking to get yourself or your friend some help and hearing what their direction is. Um, because if you don't know who the school social worker is, the teachers probably do. There are also a few mental health clinics here in Franklin. And so searching those up, giving a call, saying what you're looking for, and they would be able to set you up with a clinician there for sessions. And then there are also resources online to find individual practitioners as well. The most popular kind of search engine to find a therapist is probably psychologytoday.com. But there may be others. That's just the one that I'm most familiar with, and most colleagues I know have a profile on there, regardless of whether they work independently or with a clinic or otherwise. So I think those are probably the best steps to take. There are some other resources I wanted to point out as well, though, that here in Massachusetts, we have mobile crisis care, and this is provided through community behavioral health centers or CBHCs. And there's a number that you can call, 833-773-2445. Or online, you can go to masshelpline.com. And when you're in touch with them, it goes to a centralized area, but you tell them where you are and what you're dealing with, and they'll connect you with your local CBHC. And the turnaround time for those services is meant to be an hour. So this is for like really acute moments where you have imminent concerns for what you're dealing with, or want somebody looked at right away because maybe they are escalated at the moment, and having a clinician be able to de-escalate the situation and also interpret what's going on could be really helpful. That's a great resource for that. And then in critical situations, particularly involving personal safety, if somebody is feeling suicidal, then if they are not an immediate threat, CBHC is a great resource. But if they are a more immediate threat, don't hesitate to call 911 and let them know that there's a psychiatric emergency and somebody is a threat to themselves. And they eventually would hopefully get them to a hospital. And a middle ground before those two is also going to local emergency rooms.
Very needful advice. Thank you, Reese.
You're welcome.
Um, Finally, what is the best suggestion you can give to Gen Z, or especially to our community, to stay balanced and how sooner they can come out of the distress if they feel any distress, or the way they go every day, day to day, how would they come up with their issues and resolve them?
So this is another question that the details of which are going to come down to the individual. But I think there are a few pieces of broad advice that they can apply that are also generally helpful to anyone of any generation. Um, One is that if you're feeling hopeless, remembering that what is happening is only for now, that things change. And even when you're feeling um, very low levels of hope or complete hopelessness, and these are moments where this is hard to see because of the nature of that emotion, but remembering that emotions pass, that things are temporary, and and looking for those opportunities to that are within your control to move things in a different direction. Certainly with high degree of hopelessness, I encourage people to seek professional support for that. But when when you're in high school, when you're in college, often stressful things seem huge. Whether it's conflict with a friend, a rough breakup, a failing a test, and that can be very overwhelming. And keeping in mind that this too shall pass, so to speak, that there is another side of it, that event is not going to define the remainder of your life, um, is really helpful. And that it's okay to feel the feelings as well, that those moments can be very hard and come with very intense emotions, and relying on your support network, whether that's friends, family, or services at the school, I think is really helpful. Another thing that I would want to encourage, again, everybody, but this may apply more directly to younger generations, is making sure that you're taking the time to connect with your friends in person. And especially outside of a school setting, creating your own settings for being together. And some young people are very good at that, and other young people find that they see friends at school and then talk to them online, but there's not much in between. And I want to encourage people to make sure you find that in between. Um, and finally, I would want to encourage, again, everybody to try to be mindful about the amount of time they're spending with their technology. Trying to measure the amount of time you might spend scrolling TikTok, Instagram, Facebook, whatever it is, because that tends to be lost time, and it tends to drive anxiety. And there are different ways in which it drives anxiety for everybody, but it tends to be something that feels good in the moment that has longer term consequences, the same way that eating all your Halloween candy on Halloween night in a couple of weeks might feel. It might be awesome in the moment and then regretful a little bit while later. And when things like, these social media feeds have worked their way into daily routines for a lot of people, I think there's a lot of risk there in attention being drawn away from things that are important. And also a feeling of that, like, I don't have time to go for a walk today, for example, which, well, if an hour went into scrolling, maybe there was time for a walk that went elsewhere. So trying to be mindful of that, and thinking about the opportunities that you have and what you want to do with those moments. And is scrolling really what you want to do in that moment? It's okay for the answer to be yes sometimes, but I would encourage everybody to find balance with that.
Great advice, Reese. Harris, is there anything you want to add to our conversation that I haven't missed?
Yeah, I think one thing that I'd like to speak to is the importance of destigmatization of mental health challenges in our communities. I think both the concept that things need to hit a certain level of severity before seeking professional help is something to be challenged, that their short-term therapy exists and can be really helpful. Sometimes even as short as 2 or 3 sessions, for example, to address something that's going on, set goals, and follow through. And also not being afraid to talk about mental health challenges. Moments of depression, moments of anxiety, moments of not feeling okay are very normative to the human experience. And the more that we can acknowledge that that's the case and connect with one another to provide support, the lower risk we will all have, because it's something that barrier that the stigma creates will no longer be there. So I encourage families to talk about mental health with their kids, friends, to bring up tough moments with one another, and to listen and be supportive. And yeah, so that's another important piece when it comes to the community mental health mindset.
Thank you.
Thank you. Something.
Sure. Um, and thank you for your valuable time and compassion in helping our community and to improve our community mental health as well. Thank you so much.
You're welcome.